One of the things we are seeing quite strongly in the data is how effective vaccines actually are in terms of reducing hospitalizations and reducing deaths, but they have to reach the people who need them most. And so it's not just about how much vaccine coverage there is, it's about who is being vaccinated. It's not even just about who is vaccinated, it's about who isn't. And what are the populations that are missing the critical need for vaccination? People with underlying conditions, people who are over the age of 60, our frontline workers. And in far too many countries, those vaccines are not reaching those individuals. We're seeing across Europe, across the world, transmission is increasing. Transmission is driven by so many factors right now. The variants, increases in social mixing, which began months ago. The patterns that we are seeing across Europe, the patterns we're seeing across the world are entirely predictable. Because when you lift public health and social measures, when you lift the rules around masking and distancing and improving ventilation, avoiding crowds, in the context of variants, in the context of increasing social mixing, in the context of limited vaccination, you're going to see the virus thrive. And that's exactly what's happening right now. In the Northern Hemisphere, we are entering the winter months. People will spend more time indoors. What we are saying to all countries right now is look at your situation, critically assess the situation that you're in right now, and make adjustments. Use the tools that you have, whatever tools you have right now, improving your surveillance, appropriate testing, linked to public health action, getting that vaccine out, but also physical distancing, wearing of well-fitting masks, avoiding crowds. All of this will drive transmission down as we get vaccination coverage up. The deaths that are happening right now are just absolutely tragic because they can be prevented because we have tools. So we need to look at what's happening right now in every country around the world and make some course corrections using the tools and the capacities at hand, while at the same time fighting as hard as we can for vaccine equity to get those vaccines into the arms of the individuals around the world.